I'm Kim Bannister. I'm GP in Mairangi Bay, and a job I've enjoyed for the last 30 years or so. And I've got a part-time job with the Waitemata District Health Board as a primary care advisor, which is where I've been involved with the Auckland Regional eReferral project for the last 3 years actually. So it's been a long journey and quite a complex one. I've been on both the steering group and the clinical reference panel for the eReferral project. So I've been following the project through all its complicated stages of contracting, and then the process where we've been negotiating with 3 of the local DHBs, the Auckland DHBs, and their different services about the design for the templates or forms for the eReferral project. When GPs start to use the system, they'll find that some of the forms are very easy to use. They're quite simple forms, and as much as possible it's automatic, so that the form pre-populates with the information that's available in the practice management system, so long as it's correctly entered there. And the amount of data entry that the GP has to do is, kept to a minimum. That's been the guiding principle for the process. And I think that some of the forms are good because they give guidance to the GPs about what are the appropriate steps that you should follow when making a referral. For example, gastroscopy, endoscopy, for investigation of a stomach ulcer. The form is designed to follow the Auckland Regional pathway for dyspepsia, and I think it works quite well, and it's fairly simple for GPs to follow, and takes them through the steps that are needed to ensure that the referral is appropriate. And at the other end, at the referring end, the advantage is that the referral contains the appropriate information that the specialist needs to allocate the right priority to the procedure, especially when there's a long waiting list for a thing like a endoscopy, a gastroscopy or a colonoscopy. One of the big advantages of the new system is that it does offer different options to GPs other than just requesting a first specialist appointment at the hospital. In particular, you've got the option to ask for specialist advice about a problem, and I think this is going to be a very useful facility for GPs to ask a hospital specialist for advice about how to manage a particular problem without necessarily that patient having to attend a hospital appointment, and that saves the hospital system the slot for the patient appointment, and of course the patient doesn't have to attend an appointment unnecessarily. So that's going to be, I think, a good option, so long as people are aware of that, and hospital systems are designed to pick up those requests for advice and respond appropriately to them. So I think it's the start of a communication channel between primary and secondary care, and I think we've got some way to go on completing that loop with the feedback back from the hospital to general practice, but it's a step forward in the model of integration of care, so that we have better communication between the primary and secondary sectors. And to me, that's the real value of this project, that it's going to make that easier. I mean, obviously, the original reasons for setting up the eReferral project around increasing the security of the referral process is a critical justification for the project, and it's great to put a referral through and you get the acknowledgement back within half a minute that the referral's been received and acknowledged. So if you do the referral with the patient in the waiting room, with the patient in the consulting room, which I think is often possible, it's great for both parties to see that the referral's been done and acknowledged. It's quite a satisfying sort of result.